According to the CDC, adverse drug events contribute to more than 1 million emergency room visits, many of which are preventable. And here to discuss medication safety and education is Chief of Staff for the American Pharmacists Association, Raphael Saenz, and Chairman and CEO of Tabula Rasa Healthcare, Calvin Knowlton. Thank you both so much for joining me.
Thank you.
Thank you.
Calvin, starting with you, tell us about the new medication safety education campaign that's going on.
Well, this is October, which is National Pharmacist Month. So Tabula Rasa hooked up with the American Pharmacists Association regarding the safe use of medication. And the reason we're interested in the safe use of medication is because adverse drug events are becoming increasingly problematic in the United States. Let me give you a couple of statistics. For older people, for seniors, that are taking, on average, 42% of them are taking 5 or more prescription meds, plus they're over-the-counter, plus herbals and things like that. They're taking a lot of meds, and the data shows that once you're on 7 or more meds and you're a senior, you have an 82% chance of an adverse drug event annually. So what we're trying to do is to put the spotlight on that, to let people know, and let people know that there's a way that they can help themselves to avoid preventable adverse drug events.
And Raphael, what factors might contribute to an adverse reaction to a medication? Calvin mentioned taking, several prescriptions at the same time, but what else?
Sure, there are several. And before I answer your question, I just want to say a big thank you to our nation's pharmacists and pharmacy staff as they provide essential and unwavering support during the COVID-19 pandemic. But back to your question, though, there are some things that you can change and address, and there are some things you cannot when you're talking about adverse drug events. Some of the risk factors that you cannot change, things like your age, how old you are can sometimes determine how quickly you clear a medication from your body or not, your sex, and the number of conditions you're trying to treat at any one point in time. The things that you can change and you can address is the total number of medications that you're taking, and then removing some of the unneeded or unnecessary medications from your regimen. What you eat, over-the-counter medications that are often not reported to your pharmacist. All those things can contribute to adverse drug events. In addition to what Dr. Knowlton said, a lot of times patients will go see several physicians and receive prescriptions from several of them, and they will fill them at various different pharmacies. And if you don't have the pharmacists talking to each other, it just sets up a scenario where you are more at risk for adverse drug events.
And so how do you see the role of the pharmacist in patient care and safety? Obviously a very important one.
Yes, so the pharmacist is singularly best positioned on the healthcare team to help patients make the best use of the medications. If you talk to your pharmacist, they can review for you your medication regimen, your medications as it pertains to other medications and whether they'll interact or not, your medication as it pertains to food and whether the food will make it more or less effective, and your medication as it pertains to your disease state. Believe it or not, some medications will actually make some certain diseases worse. Now, you don't intend to make it worse, but if you're taking a medication for one ailment and you happen to have more than one ailment, it might make your second or third ailment worsen. And so it's important that you talk to your pharmacist about how and when and where you take your medications.
And Calvin, how does technology play a role in reducing the risk of these adverse drug events?
Well, pharmacists have the technology to help identify and mitigate preventable adverse drug event risk, but the question is the input that goes into the technology. The local pharmacists will have in their system what you've received there in that pharmacy, but you may have had, as Dr. Stein said, you may be getting things from other pharmacies, and you may be taking over-the-counter meds and herbals, and you may be taking recreational. These are all medications. The body doesn't care if it's an over-the-counter prescription. It's still a foreign object, and it has to deal with it as it deals with drugs. So what we're asking is pick a quarterback pharmacist, go to them for 5 minutes, talk to them, and let them see everything you're taking. Then the information technology can be used appropriately.
Very important pointers and reminders. Thank you both so much for your time today.
You're welcome. Thank you.
And stay where you are. We'll be right back.